Ministry is healthcare. Sometimes patients have questions or concerns, especially those who are on a number of medications. Imagine how complicated it can be for someone taking up to 12 different pills a day. That is where medication therapy management comes in. Our ministry workers at St. Elizabeth's are fulfilling our promise for patients in need.
Most of my life I took other family members to the doctor, and then suddenly at about 50, all of that changed. I started developing neuropathy, ended up with bladder cancer and having several surgeries for that. I have medication for diabetes, medication for blood pressure, and anticoagulants, and keeps cholesterol low, and I take about a dozen a day. You get so much information when you have that many medications, and you try to keep it all straight, but it's not always easy.
I am a nurse, and so I'm aware of why he needs all of them. But it is a lot, and it really is helpful for us both to go to his appointments because he has several serious medical conditions, and it's hard to remember all the information you get and all of the directions you're given.
Medication therapy management has kind of been an evolution. Basically, we just have the patient meet with us in a private setting. We ask them to come with lots of questions and lots of knowledge, and then we just go through each drug one by one and look for things that we could possibly make suggestions on to improve how they're taking their medications.
Most of my training has been doing patient counseling and helping patients better understand their medications. What I realized was that the more we got the patients involved in their drug therapy, the better results we saw down the road.
Like a lot of people my age, I feel it's really important to be proactive with my health. So I'm constantly reading, researching, and I didn't realize that every time you add a new supplement, it can interact with something you're already taking. I found that a lot of the things I was taking all at the same time and defeating the purpose of it.
The thing that surprised me is how many people are excited to know about their medications and that they want to take them correctly. They just don't always understand what they're supposed to be doing.
I recommend 3 pills.
I was so impressed with Bob and the whole program, especially because when I got finished talking to him, 2 days later, he sent me a confirmation of everything we had discussed in the mail, which was perfect.
Very often we see that look in our patients' faces. They think, wow, if I take that with food, that could make that much of a difference. I didn't know that. That means a lot to us, and that could change the outcomes for sure.
You recommend taking them multiple times a day? Or I discovered that some of the medications that I was taking, I wasn't getting the full effect of them because I was not taking them correctly at the right time of the day. So I just wanted to avoid all that. I have enough problems without that.
I'm sure it gave him more confidence that he was taking things correctly and needed everything that he's on.
We do everything we can to educate the patient and to provide the patient with the best therapeutic regimen that could solve the problem and the illness. That's always been our goal and philosophy in everyday work.
I think it's been successful here partly because people are used to working with St. Elizabeth's. They realize that everybody here is very concerned about giving them the best care that they can get.
What are we truly here for? It's not about us collecting a paycheck. It's not about making sure every fine detail is done. Those things are great, but we really need to make sure that patient care comes first.